Again, thank you very much for doing this. First of all, everything in the news right now is about coronavirus, and we're upticking here in San Antonio. You have seen it yourself in your family, and some people, it must be frustrating for you especially, who say it's a hoax. They're pushing us to lock down when we don't really need to even wear masks. First of all, tell people what's happened in your family.
Sure. Well, when people say that it's a hoax, it's very sad to me because I have personally been hurt by loss, and my family has been affected. And so we have lost 7 family members to COVID. 6 of them were here in the city of San Antonio. 6 of them were in a zip code, which is the most impoverished zip code in San Antonio. And so when I saw the numbers, when I was seeing the number of people on ventilators and hospital beds, etc., it wasn't just numbers, it was names. I could tell you so-and-so is at this hospital, so-and-so is here. And so I find it just so disheartening that people still don't believe that COVID-19 is real. And so as you look at the numbers every day, and the mayor and the judge are updating us on ventilators available, etc., at one point during the pandemic peak, if you will, in June, we had 15 members of our family in hospitals. And so they were all at varying levels of need as far as medical attention. But it was very hard, right? Because then I could think, oh, well, so-and-so just got plasma, so hopefully they'll be recovering. And then we did see it a few days later that they were doing better, but so-and-so didn't get plasma and didn't get a chance to get plasma, or just didn't make it before, we were able to do that. And so it's been really difficult trying to figure out how to let people know that they still need to protect one another. And so with the whole asymptomatic cases that are out there, we don't know. We don't know who is carrying the virus, and that's the most dangerous part of it. And one of the things that I keep reminding people is that it's so simple. What you can do is just wear a mask. You might not have to wear it, inside your home if you're living alone, or if you are with close family members. But if you're going outside, try to wear a mask. And so I don't know how else to stress that. And I felt it was important. I'll be completely honest with you. I hadn't shared with anybody about my family other than with the mayor and the city manager and the
until the council meeting.
Right, until the council meeting. And so
in August, right?
In August, on August the 13th, we had a council meeting, and we were talking about how COVID has impacted our community. We were going to talk about a workforce development issue. And so I opened up that day, and the reason that I did so is because I thought, people need to put names, right, and associate people that they know to folks that are dying. And the reason that people are dying, and folks that have underlying health conditions like my family members. And so I opened up that day, and Randy, it was really hard, and let me tell you why it was so hard. I had drafted my remarks. I always try to draft my remarks ahead of time. I knew exactly how I was going to deliver the message and tie in the social determinants of health, basically. However, about 10 minutes before I spoke, and by the way, this was also the day that I was delivering remarks for the 100th anniversary of the ratification of the 19th Amendment. So I had just done this whole girl power speech, like, we got this next week, everybody celebrate with us. And about, maybe 5 minutes after that, as I was getting text messages from women that I know saying thank you and that they're excited about participating, one of the text messages that came in was from my priest at church. And as I was going through the text messages, I finally got to his message about 10 minutes before it was my turn. And I read it, and one of our church family members had passed away of COVID. And this woman, to me, was a pillar in our community. She had been an election judge for more than 30 years. She served her community with pride and respected the church and folks around her. And so to me, that was a big loss. I served with her on the finance committee because she worked at the church. And so her and I were the ones that had to come in at certain times to make sure that the finances of the church were taken care of. And so it was very difficult that day because here I am. I just delivered this women's empowerment speech, and one of my women role models from the neighborhood passed away of COVID. And so it really struck me. And although I had, practiced my speech, I got a text from the mayor saying, "Hey, you're next." And I texted him back and I said, "I don't know that I can do this." And he's like, "Why?" And so I forwarded him my priest's message. And it was very difficult, but I kept going, and I tried to not cry, but it was just too overwhelming. I just couldn't hold it. And so I broke down during council. And so, but I made it through. I made it through the speech, and I got across what I wanted to get across. And it was that folks that don't have access to healthcare, that don't have access to a good quality of life, are already kind of at almost a losing end.
Yeah, now talk about what you said there, because you said, I have 6 family members who have died of COVID. And you talked about the number, aside from that, who had COVID. That's just amazing. Some people I've talked to say, well, I don't know anybody who's had it. And so it's hard for them to really understand the pain and the threat. What has it been like for how many months when you've seen those people pass away and go into the hospital?
Sure. Well, let me tell you that we have had at this point, more than 30 family members with COVID. And so it was mostly here in San Antonio, but we have had a few in Mexico. And so the hardest thing about it, Randy, has been that I'm an only child, and I can't hug my parents. So the 6 deaths that I was referencing from San Antonio, my 6 cousins, and then my uncle in Mexico, all were on my dad's side of the family. And so for my dad, it's been incredibly hard, but I can't hug him. I, have to call and check in on him. My mom was calling me really often and saying he's crying again. Está llorando otra vez, right? And so I would try to call his mobile and just, pretend that I didn't know and just check in on him because he'd be crying outside. And so it's been really difficult to not be able to hug my dad. But Randy, I also have to keep doing the people's work. And so I have to keep working food bank events and supply distributions and being there for the community. And I'm being extra careful and wearing gloves and wearing a mask and making sure that I protect people, but I also have to protect my parents, and that means not being able to hug them. So my way of being there for them right now is literally stopping by and just talking to them, seeing if they're okay. A few weeks ago, I was really happy because I heard my dad laughing for the first time, and so that was so cool. He was on the phone with someone just laughing and laughing about something, and I thought, goodness, I hadn't heard that in a while. And so he's been obviously devastated. And so when he would call, I would keep in contact with one of my cousins, particularly that way we wouldn't bother all of the cousins. And so she was kind of like my central go-to person. And so she would say, and so is on a ventilator, and so is on oxygen, and so just got plasma, and so is moving to another area where they're doing better, right? And so she would keep me updated, and again, she was kind of like the go-to. That was on my dad's side of the family. Then on my mom's side of the family, I had one entire unit who had COVID. And so my cousin was in the hospital, and I was still able to communicate by text. So I was checking in on him, and I was like, have they given you the plasma yet? And so literally, I would just text him every few hours, just checking in. And so he was my direct contact. Luckily, none of his family members went to the hospital. It was only him. And so, and then I would have to report back to my parents. So the most difficult thing was having to drive over to my parents' house to let them know that someone else had passed away. And so the most recent one was my uncle. And although he was in Mexico, I got the call from my cousins. My cousins and I, we keep contact, to let each other know about our parents and how our parents are doing. And so even though they're in Mexico, I still reach out and follow up on my uncles. And the most difficult thing, I think, was driving over that day. And when I got there, he was already crying because one of his other brothers had called him to say that his younger brother had passed away. And it was very difficult. And so my son, goes with me every single day to visit my parents. And so he too has kind of felt like he can't do much, right? Because there's my dad crying, my parents are both crying, and we can't just reach over and hug them. And so we're very tempted to do that, but again, I'm trying to protect them. My cousins here are all trying to protect them as well. When they come over, they visit outside. They'll drop off, if they need food of some sort, or if they're going to the groceries, they go on a grocery run, they'll drop those off for them outside, or they'll come in quickly and drop anything off and then leave. We don't stay too long. I think that's what's been very difficult. The good thing is that we're really good on the phone still, and so we still call them and chit chat with them, and so that's a good thing, I guess, about having a big family, is that there's always someone on the phone with my parents helping them.
Well, now it also, you talked about it, I believe, in the meeting of how COVID, and we've done stories on it, hits different communities harder, and people with underlying conditions. And you talked about people in your family. But people have also kind of dismissed, that person had an underlying health condition, almost as if, it wasn't really COVID that killed them. And some people say that outright on Twitter or whatever. What's that been like? How do you react to that?
Yeah, well, and that's, I think, why I've been trying to push so hard for people to realize that there's multiple factors that affect whether you survive COVID-19 or not. And so a lot of those underlying health conditions, if you think about heart disease, and if you think about diabetes, and you think about hypertension and asthma, a lot of our folks in the city, a lot of the folks that I represent, have maybe 1, 2, or 3 of those things. It's a combination. So that makes their chances of surviving COVID even more slim. And so I think that's been the difficult thing, right? And so, yes, maybe they already had hypertension. However, you add something unknown like COVID, and especially at the beginning of the pandemic, and they're already at a higher risk for not being able to survive. So that's why it's important for us to talk about as a community the importance of everyone coming together and learning from this, so that this doesn't happen again, or the next time that this does, something like COVID-19 or another pandemic gets here to San Antonio, that we know exactly where our most vulnerable residents are and how we should reach out to them.
And we talked about a lot in the news about ethnicity, minorities, but it's not just that, it's socioeconomic, and it's also the conditions in which people live and are used to living, the proximity that is putting more people at risk.
Yes, absolutely. So, Randy, if you think of the residents, for instance, of District 4, we have essential workers. A lot of them are essential workers that kept working. They live with a big family. And so that means that they had to keep going to work. And by the way, some of them work 2 or 3 jobs. And they had to keep going to work to put food on the table. Then they came back and they brought COVID with them to their family members. And so a lot of our families are mixed families that have their grandparents living with them as well. And so when we think of how this affects the death rate in the elderly population has been higher, then we can see why we need to protect everybody, because we're all in it together.
And now in your past, I know you've done some projects about health literacy. And so you know firsthand from research, as well as from your family, how, and from your constituents here on the Southwest Side, what that means. How do you get across to people the importance of it, especially here?
Sure. Well, health literacy is complicated enough in your native language, right? And so add something if you don't speak the native language, then what happens? How do you understand it? And so when I was at UT Austin working on my PhD, I got to study with Dr. Michael Meckert, who oversees health communication over at UT Austin right now. And so I was able to work with him with Hispanic families who needed that translation, if you will, not just literal translation, but really a cultural translation, understanding how health affects populations. And so I knew that there was something beyond a direct translation that needed to be done here, and we continue to push for that. When the beginning of the pandemic was coming, if you will, I knew that a lot of our residents, they already experienced the digital divide. So we don't have access to as much computer information at our fingertips, if you will, in our areas. A lot of our population is actually older as well. So they don't know how to access some of this information that others might be able to have access to. And so I was able to ask for robocalls. And so we were able to pay for robocalls through our city council budget for our office. The city was doing their own outreach, but I knew that my residents, they were different. And so we needed to focus on them. And so I also did postcards to our residents, because our residents, they still like getting postcards. I mean, if you think about it, think of this last election season and how many postcards you got in the mail. So they work. And so we need to keep doing that. I asked for door hangers, and eventually the city decided that it was a great investment to do door hangers to the 10 tracts that were most impoverished in the city of San Antonio.
And telling them what?
Telling them about COVID, reminding them what they could do to protect themselves, letting them know that this was obviously something that was going to be around a little bit longer than expected, that there was no cure for it just yet, but that there is prevention.
And so door to door, there's been some door to door as well.
Yes, we have done. So at the beginning was door hangers, and even now. So I'm happy to report that there's several city departments that are working together. So not only the health department and our fire department, but also our Department of Human Services. And so they had a goal of reaching out to, I believe it was 75% of the residents in these tracts, and contact them directly. One, to tell them about COVID prevention, and two, to let them know that there was help available should they, one, become, or get COVID, or as a result of COVID, if their job was impacted, for instance, or if they needed help with rent or utility assistance. And so we have been doing that as a city, and so I'm very proud of that work, because they continue to see that it's needed. And I'm especially proud that our city council has all teamed up together. I've seen some of the city council members who maybe have not seen as much of an interest, if you will, other than in their areas, now say, hey, what about District 4? Why are they at this number? And so it's really good when you have champions beyond yourself saying, hey, wait a second, this is something that we need to look at as council.
And some of those first maps, and even now, describe to people how it has hit this area compared to other areas of San Antonio.
Sure. And so, Randy, I'd been watching, and just in general, so I listen to a lot of different news sources, and I knew there was something going on in China. Like in December, I started hearing about something. And so, of course, it's just kind of news at the time. And so we kind of monitor it. But then in January, you start hearing about the cruise ships. And it was probably very late January, early February, when we got wind, and it was rumor that San Antonio might get some of the Princess cruise ship evacuees from Wuhan. And so I started doing as much research as possible to see what was going to happen. And so at the time, it was very tight-lipped. There wasn't too much information that we as local city officials were given. And so so one Sunday, it was very early in the morning, and I was like, you know what? I'm not going to wait. I'm calling our federal delegation, and I called all but one of our federal delegates, and I asked, what's going on? If you don't know about it, you need to know about it, and you need to tell us what's going on. And so I'm not afraid to pick up the phone and call and ask. And so I had great response across the board from Congressman Joaquin Castro called back. I was at church. I stepped away to take his call. Senator John Cornyn also right away. And so it was a great response. Chip Roy, different people, Henry Cuellar. I'm telling you, It was an all hands on deck movement to see what can we do to figure out what's going on in San Antonio. And so by the end of that week, Senator Cornyn actually flew down and met with the mayor and Councilman Perry, because Councilman Perry is our military liaison on council, and myself because Lackland is in my area. And so, and we were able to at least get them on board saying, we need answers and we need to be involved. And so the mayor and STRAC, the South Texas Regional Alliance Center, have worked with all of the hospital heads and started planning right away. What we do have to realize, and I don't think people realize this, STRAC is in D4. And so even before the pandemic, I got to visit with them, and they already had a plan for our hospital beds. So they knew, and this wasn't for just pandemic, they just knew, they knew the stress levels. So we were able to adopt really well based on their experience and their modeling. And so we have such a great resource, and then I'm very happy that they work very well with all of the hospital systems. All of the hospital CEOs were at the table as well. And so I was happy that there was that great response right away. And because we had that experience, we were able to be prepared for what was coming.
It conditioned some people also to know the threat of this and to realize it was here in the citizens of San Antonio. So we may have reacted a little better. Yes, earlier.
Definitely, and I think we were prepared. And Randy, I do have to say that the residents of District 4 were great. So there was a couple of calls that came in, and they were scared. Of course, you don't know what this is, and so we had to explain, well, they're going to stay on the base, etc. And so we explained the process. But a majority of the calls that came were actually worried about our military service women and men. And so they want to make sure that our military members were going to be protected. And so one of them even called and said, can we send them extra masks? What can we do? Can I buy masks and send them? And so it was an outpouring of support from D4 for the military. And so we are Military City USA. We have a lot of veterans that reside in District 4. And so I was very proud of their response at the time as well.
And now the numbers in terms of the people affected here compared to other districts, at one time anyway, I don't know what it is now, was higher than you would expect. Is that because you think of health issues or?
Definitely. About 26% of our population of our residents in D4 does not have access to insurance. They have underlying health conditions. The ones that I mentioned earlier are the predominant ones in District 4. And so when we look at a population that already doesn't have insurance, they might be holding back from going because they think they're going to get charged, for getting tested, etc. And so, Randy, at the very beginning, when we started updating the numbers, I was looking at my zip codes, and I could tell you, 78236, that's one of mine. 78242, oh my goodness, there's already 300 cases. I need to start looking at this. 7822, you name it, right? And in my district, and we unfortunately were some of the leaders of the pack.
And now it also drives home a point that we've done stories on over the past few years of inequity. The life expectancy in different parts of town is so different, up to 20 years. And I believe some of that is in District 4, some of the lowest life expectancies. Have we done anything about that, or is this at least maybe going to get us more aware of that problem and do something about that underlying?
So I think that this is an opportunity. I think people are finally realizing what we've been talking about for years. Now it just hit us in big numbers, if you will. And so we have had so many people reach out. The Bexar County Medical Alliance reached out to see how they can help. We have also had Southwest General Hospital, and the doctors at Southwest General Hospital explained how stressed they were at a point where they had to fly in doctors from New York. So on average, an ER doctor sees about 15 patients a day. they were seeing 45 patients a day per doctor. And so they were overloaded on their hospital bed count. And so they could maybe say they had beds, but they didn't have enough staff. And so we know that a lot of the residents in districts 3, 4, and 5, which are surrounding areas, also go to Southwest General. So they reached out and they wanted to make sure that they shared numbers with our representatives. And so Councilman Villagran from District 3 and Councilwoman Gonzalez, Shirley Gonzalez from District 5, and I were able to meet with the CEO and with the team and learn a little bit from them and see what it is, what kind of advocacy they need at the city level where we can help champion them. And so we've had an outpouring of support even from that. Valero reached out. They gave every single one of the staff members at Southwest General gas cards, $25 gas cards, in appreciation of their service. And so we've had different organizations also reach out and say, hey, do you need help for Thanksgiving? Tomorrow we're doing a big turkey giveaway. We have 300 turkeys that we're giving away with corn and, you know, all of the trimmings for our residents. And so this is an entire community that stepped up and said, hey, your residents, the residents in the southwest and the south side and the west side of town, they need help, and we're here. And I'm so proud of that work that the city of San Antonio has done.
Coming up on a holiday like this, you have to have some concerns. Now, I understand, I'm not sure if it's in your family that they said maybe Father's Day get-togethers could have played a part in what happened with your family.
Yes.
Looking ahead to Thanksgiving, what are you worried about?
I'm worried in general about how people have been at home for so long that they're missing that social interaction. And I totally get it. I miss social interaction too. But we also have to remember that we have many more Thanksgivings and holidays to look forward to. And so it's just going to take one small sacrifice. And so if you can do an outdoor event, if you can do a drive-through event to visit perhaps somebody in your family who has an underlying health condition, that's the best way to go. We were very concerned, for instance, in the Hispanic culture about Dia de los Muertos. And so November the 2nd, traditionally you get together with your family and you celebrate your loved ones. And so I'll give you an example of how I celebrate this year. Usually we celebrate with my family and we bring some of my cousins over and we'll talk about someone who most recently passed away. We'll share memories and we will do the breaking of the bread, specifically the Dia del Muerto bread, and share that pan de muerto. This year I just set up an altar at home and I brought my dad over and he just, visited the altar and said, his quiet little prayer in front of it, and then he left, and it was just he was maybe there 5 minutes just to see the altar that I set up.
What do you plan for your Thanksgiving?
For Thanksgiving, I'm going to make a turkey at home and then go take my parents a plate. And so that's what I'm planning to do. If it's not too cold, then I can sit outside and have it with them. I try to stay there only for 15 minutes or less. And so, but I call them all the time as much as possible. Yesterday, I dropped off lunch to them. So I had a little break in the lunchtime yesterday. So I told them I'm bringing lunch really fast. And so I try to do as much as possible to still see them.
But now as these messages come out, just like yours, there are mixed messages from officials and a lot of resistance to that. You talked about working with Congressman Roy. This week he tweeted, I'm going to do what I want for Thanksgiving, and then retweeted, let me make it clear, I'm going to absolutely do something like that, what I want. Meaning, and people then commented, the nanny state shouldn't tell us what to do. When you hear that, what goes through your mind?
It's disappointing, right? So definitely. And so I understand that maybe some folks haven't been hurt personally. I hope that they never get to go through so much loss, such as a loss that my family members have gone through. And I would hope that they try to inspire others instead to work with one another and look out for one another. So yeah, it's definitely disappointing. Some of the mixed messages. I do believe that we should be listening to our medical experts. I do believe in following the recommendations that not only our CDC but that our local health officials have provided. I think that the governor has also done his part in trying to learn and understand before just going to Twitter, right, and sending sorts of messages. And so I'm appreciative of folks who listen and who understand and aren't just using something for political propaganda.
Looking ahead with the latest numbers that we've seen, that uptick here in San Antonio, a little more concerned about hospitalizations. We have more than 60 people just from El Paso here. And we had a prediction yesterday from the mathematician at UTSA that we could be in trouble in the new year. Where do you see San Antonio in terms of the future right now?
We as a community need to realize that we are all in this together. And so continuing to push the message of wearing masks, we actually have our GPA staff at the city has started a new campaign called Do It for SA. And I believe in it. I think that we all need to be wearing a mask for the city of San Antonio to continue living life as close as possible to normal as we can, right, eventually. And so it's going to take a while before we get the vaccine. It's going to take a few probably rounds of of trial and error before we are able to get to administer the vaccine to most of the folks who are most vulnerable. And so we can't afford not to do one simple thing, which is wear a mask. And so I think that continues to be the message, and it should be.
One other way I'm sure you drive home this point is to describe what it was like, not just the fact that they died, but then how you had to deal with that as a family. So different than those of us who've lost loved ones in the past. What was that like when you had, I understand there's some live stream services, there were some simple processions and things put off?
Sure. So I'll give you one of the other tough things that I've had to do is my dad wanted to go to the funerals of his nieces and nephews. And so, by the way, he lost his oldest niece, and she went with her oldest son. And then we had another one of his nieces and her husband passed away. Another one of his nieces and her husband passed away. And so for the first one, and again, imagine, and I know that there's families out there who the aunt and uncle are their everything, right? And so let me tell you why I am so fortunate to have had my cousins in my life. My mom was very ill when she had me. She was on bed rest before and after, and so those cousins were the ones that took care of me when I was born, like literally changed my diapers and helped feed me, stayed awake through the long nights because I was a crybaby apparently. And so they helped me be here. And so because my mom couldn't. And so my aunt at the time sent them over and they would take turns. And so to lose them, to see my parents through all of that, just loss was devastating. And so one of the things that we had to do, so my dad wanted to go to the funeral, and I said, no, you don't understand. There isn't going to be a big funeral. You can't go. And my cousins told him, for instance, in that example, one of my cousins called him and said, no, whatever you do, we're all sick right now. We have COVID. Please don't even stop by our house. Stay away. We're not even going to go to the funeral. It's just, they're going to drive by the procession. And so I committed to my cousin to taking my dad the next day. And so to visit the grave, and it was so hard. We had to stop by and buy some flowers. He went to pick out some flowers, and we stopped by. And, just looking at my dad, I brought gloves, and we held hands and prayed over my cousin's grave. And so it was just so difficult because...
Well, that was it.
Yeah, that was it. And so for my others, there was Zoom funerals. And so for one of the Zoom funerals, I brought my parents over to the house, and I made sure everything was cleaned and disinfected and set up so that they just come and sit down. And they did, and they had to literally watch a double funeral on Zoom. And so that was my cousin and her husband. And so, and my parents have never used Zoom, right? And so they're not familiar with technology. So then I was trying to say, oh, look, and so is here virtually. And look, there's so-and-so watching from, from this place. And so is here. And so I was scrolling and showing them, and they could see their friends and relatives sitting at their own living rooms watching, streaming the funeral. And it was very difficult. And so, I just can't tell you how difficult that was. And so I never imagined that we would have to do a Zoom funeral, and then it was a double funeral at that.
And now going through all that with your cousins, with your parents having to deal with that, I imagine that's helped inspire you to redouble your efforts to make sure that we are doing what we can in San Antonio and in your district to fight COVID.
Sure, absolutely. I'm not stopping. I continue to ask for the numbers. The district right now, District 4 that I represent, has had 14.2% of the overall deaths in San Antonio. If you look at the districts that have been more affected and have over half of the deaths, they're all of the ones that are most in need. And so all of the ones that have the least insured, that have the least access to health care, access to quality of life, lowest levels of educational attainment, resulting in lowest incomes. And so we know that there's a problem. And so this is definitely an opportunity to show people. It's eye-opening. Unfortunately, these numbers are eye-opening. They're jaw-dropping. I mean, you just can't make this up. And I think that that's why, going back to the point, is that we have lost so many people. We have lost more than 1,000 people. I think it was at 1,300 last count that I saw. And so, so people who are still not taking it seriously, I don't know what else, can be done to drive the point home that there's people that are in need and people that are suffering and people that are dying from this.
And beyond just this COVID crisis, it also brings up something that we've heard talk about, a phrase, equity funding in San Antonio. And some people don't understand that. They're in their little bubble and they think, well, I want my money for my area. What do you tell them about what equity funding is and what you want for your district on the southwest side?
Sure. Equity funding has now become apparent in its need. And so we have had people reach out from, like I said, all over the city. Whereas before people were saying, oh, why are you always, talking about this? And so we have needs, just as many needs on infrastructure on our side of town. And so I think that this has made us realize that human lives are what we should be investing in. And so, again, we're all valuable in God's eyes, and we should all be working together to protect one another. And I mentioned earlier that some of my colleagues have really been interested in this. And so even for small businesses, so I've heard Councilman Perry, for instance, say, well, why didn't all the District 4 small businesses get help? Or I've heard Councilman Sandoval say, well, I noticed that in District 4. And so I hear my colleagues, I hear the mayor say, we need to make sure that we look at District 4 and 3 and 5. And so they're getting it, right? They realize that they are a part of this change that I think that can happen. And so I choose to look at the glass half full. And so we have to work together. I'm constantly working with our council colleagues. So right now I'm working with Councilman Pelaez on an initiative for the digital divide. And so I'm not on his committee for innovation, but I'm working with the Consul General and him to make sure that we do something for our area. I'm working with Councilwoman Sandoval, who is the chair of the Community Health and Equity Committee. And so we continue to champion the need for bilingual information, for flu shots, for eventually a COVID vaccine, for any type of health information. I continue to work with all of my council colleagues on different items. Councilwoman Villagran and I work together on the Workforce Development Initiative with the mayor. And so it's going to take a whole lot of different ways to see how to solve a problem, but it goes back to equity. And so,
yes. You've had strong council people here before you succeeded Ray Saldana, but it's still an issue of it's tough for this district. It's tough. How tough is it in this area to get development, to get notice, to get funding? Some people see all the growth on the north side, different parts of town, booming. Like you said, we need to put the infrastructure money there. And you raise your hand and say, hey, wait, we have needs. How tough is it to get that attention right now?
Well, it's very difficult because they have that taken care of. They have the health needs taken care of. They have, again, a certain level of economic stability where they can focus on the infrastructure. And they have been focused on infrastructure driving development. We have every other need that we have to focus on before we can even start to think about how to bring in economic development. And so I think my predecessor, Councilman Ray Saldaña, did a great job in laying some of that foundation. And so I think he was able to leverage a lot of projects like Pearsall Park, where we're at today. And so starting to talk about the quality of life and access, and I'm very grateful to him and the others that have come before him. By the way, I have to tell you, he gave me a call about a few weeks into the pandemic, and he says, hey, I'm just checking in on you. You doing okay? And I said, hey, listen, I haven't found the folder on global pandemic anywhere in the desk. I haven't found a binder on how to handle social unrest or budget cuts. He's like, are you sure? I'm pretty sure I left it somewhere in there. But yeah, so I think that groundwork has been there. I think what COVID has done is help people realize that our investment in public health has lacked over the years. And so maybe it's an assumption that everybody's at the same level, and they're not. And so I literally have friends that have never visited this side of town. So I make it a point to say, oh yeah, well, I'm working from home. If you want to drop something off at home. And so they have to come over here, and they're like, wow, I've never been over there. I had friends who texted me after my remarks on August the 13th on the dais that said, I had no idea you were going through this. I had no idea that so many of your family members had underlying health conditions. I mean, you name it. There's a number of people that were surprised. And so there was folks that texted saying, I did not realize that I knew someone who had been so affected.
Well, now, for those people who haven't been down here before, describe where your district is and what it includes. You have a lot of land here for development, but as you said, you have other needs you need to address first. Sure. What kind of potential and where are you right now? If people want to come down here and explore, what do they see?
Sure. So Port San Antonio is one of our, I would say, the crown jewel of development in our area. So they're doing a great job right now. They have employed so many people. They employ 15% on their campus. 15% of their employees are from District 4. 22% are from District 6. So we've got to beat them eventually. We're competitive on council. But they brought in many jobs over the last few years. They're also opening up an innovation center, an esports arena. Like, who'd imagine that in San Antonio?
And that all is still going on despite the pandemic.
Despite the pandemic. I mean, I think a couple of days ago, the dirt was literally moved to start doing that. And so they continue to do great things. That's one of our areas where we can, I think, grow the cyber technology, IT, everything right there. And it's great. The other area is Texas A&M San Antonio. Now there, I share that with District 3. So literally, depending on what side of the campus you're on, you might be in District 3 or you might be in District 4. So we had an event back in, I think it was January, and I said, welcome to D4, because this is D4 on this side of it. And so it's really neat to see what Dr. Matson has done with the campus. But again, we're hoping to maybe with this upcoming bond, help folks realize that we need some additional infrastructure to build that economic development. Palo Alto College, one of the top community colleges in our nation, is building a multi-generational center. And so we actually last week turned dirt on that as well. And so we are excited about the growth that we can leverage with community partners like the ones that I've mentioned, but the city has to do its part as well.
Is it a little frustrating to see the development in other parts of town and people talk about sprawl and, oh, we have this traffic, and you would like to get some of that development and those, you go to a planning commission meeting and there is development after development after development in parts of town. And how tough is it to get that here?
It's very tough, and every single time that I see that, I ask, where's District 4? How many more in District 4? And so, and I'm never going to apologize for asking that question. I think staff already realized, oh man, she's going to ask about District 4. Let's make sure we have a plan. And so I think that working together, not only with our community partners to leverage funds, but also working with our staff and helping them see the potential that is out here is important. And so we have had great investment in Toyota, right? If you think about it, over the last decade or plus decade now, obviously that they've been here longer now, they started it for us. And I think that that's an opportunity to say, hey, if Toyota came here, yes, we are attracting other businesses, but what do our residents need? Can they live, work, and play here? And so that's important. We, for the first time ever, are going to be, there's a couple of folks who reached out last week. They're going to bring market rate apartments to District 4. That's probably the first time in decades that happens.
Where's that
and
going to be?
that's going to be right across the street from Palo Alto College. And so I recommended that they also talk to Texas A&M because it's right down the street. And so I could imagine that maybe some students would want to have access to a one-bedroom studio, or maybe even some of the professors that are at Texas A&M San Antonio. And so when I came into office, I thought that was going to be my big focus. And so I was probably, I was 7 months into the job, and then I had COVID become the attention grabber, right? And so the central part of everything that we've been doing has revolved around COVID, whether it be continuing to push the events like food bank events, food distributions. We've been partnering with the food bank and actually bringing food to the neighborhoods. So instead of having distribution sites, and you saw in D4 that picture of at Traders Village, the iconic picture that has gone around the world was in District 4 at Traders Village. And so we continue to leverage our partnership with the San Antonio Food Bank and others.
You also mentioned before we started here that restaurants here could use business if people want to come in from the rest of the area. Where would they go? What parts of the city? What streets? What roads? Here?
Sure. So there are some businesses along the Valley High area that have been greatly impacted. And so they have curbside and people are still not coming to them. The businesses along Old Pearsall Road, same. So there's literally a restaurant that has at least 8 spots available for curbside and everything. Every time I drive by, there's hardly anybody there.
Why do you think
and
that is?
so I don't know if it is because maybe people are spending less money going out to restaurants. Maybe people are scared still to go out to restaurants. I have made it a commitment to go and at least once a day visit one of our restaurants, because we need to continue. We need to keep going. And so I try as much as possible to visit even some of the franchises. They employ our students. They employ our people. So, we try to support as many local businesses as possible, small businesses, mom and pop, but it's also important to go to our Bill Millers, our McDonald's, our, it's just something that we could do maybe, once a month. We know that there's a lot of fast food that's unhealthy, unfortunately, but we also know that they're paying tuition for some of our students.
Just a couple other quick questions. When you talk about students, there's a lot of land down there. There was a lot of talk about, and there still is, about Texas A&M San Antonio and how much growth can be around that in Palo Alto College. Where are you in that development? And what are you hearing about that's on the horizon down there?
We have been planning. We have a growth plan, if you will, for the area, and so we are trying to get workforce housing out in the area. So that is what's needed. So as we bring employers, we also need to make sure that there's housing available. With the housing comes opportunities for retail as well. And so that's what I hear that is on the horizon, and I hope to continue that.
How much did Toyota bring, or has it brought so far in terms of housing and other businesses to this area? We know it's brought some businesses as well to other parts of the area, but how much has it grown here for people who haven't been down on the south side?
So Toyota has really been the contributing force for a lot of our neighborhoods to grow. And let me tell you how it's affected a school district in particular. They had to have an entire high school built to accommodate the needs. And so I think that the beautiful thing that Toyota has done is that they have a backyard recruitment strategy. And so they recruit folks from their surrounding districts. And so a lot of the folks in District 4, in District 3, they work. They work at the Toyota plant or at one of the suppliers. And so not only that, but they've given so much money to our school districts as well in terms of STEM education. So they literally have given trucks so that the students could work on the trucks. They have helped greatly with scholarships through the education foundations. So I think Toyota is doing their part to take care of our community.
And for a time, they had either cut back or shut down in the beginning of the pandemic. Where are they in terms of ramping back up?
They're to my understanding that they're doing well. They're on a regular track schedule. They had been making also, by the way, the masks, the full masks, the
Plastic shields.
Yeah, the plastic shields. Thank you, Randy. And so we actually reached out to them because we had one of our nursing homes in the area that had been affected by COVID at the beginning of the pandemic, and they asked, hey, is there any way that we can get Toyota to help? And so, of course, we ran it up the ladder and asked, hey, if there's any way, if you still have some available, they would be one of the ones that we'd recommend.
A couple last quick questions.
Sure.
Other things that people might want to come down here for, where we're sitting, Pearsall Park. This part of it was a landfill, but part of it now is one of the biggest. Is it the biggest playground in the city,
Yes.
in city parks?
Yeah,
And a skate park.
Yes, the Ninja Warriors got to come out here last year, actually about a year ago, probably today a year ago, and they got to run through this track, this amazing track that we have out there. Yes, we have the skate park. We have a lot of skaters out there all of the time. We were able to give our skaters masks, by the way. We noticed that some of them weren't wearing their masks. They had forgotten their masks, so we gave them some masks as well, and so we were happy that they were able to wear them. And we're also trying to see if we could get a mountain bike trail. So that would be one of the exciting things that I hope would happen here.
And you said people here call the mountain where the trash was.
Yes, the locals call it Mount Trashmore because it used to be a landfill. So this is literally from dump to destination.
But totally safe. I remember us doing stories on the transformation. That it took a while, but this is one of the showcases really in the southwest side.
Yes, and so we hope to continue to invest in our parks. We have Camargo Park also in District 4, which used to be one of the classic parks that people think about, and we need to give it a little bit more love and attention. Hopefully in this next bond we can do that as well.
And last questions are about you, because you, one of those showcases, you are the first woman in District 4 to hold this office. You just got a national, I don't know the phrase for the, what was that?
Federation of Women
Federation
Legislators.
of Legislative Women. And what is that like? You are a role model here in this district as well as across the city. Do you feel some pressure?
I guess I always think of myself as just a hard worker. I'm just working. And so I think that that's probably the best thing that I can do is show people that I work hard, because then other people will want to work hard and they'll want to pitch in and help, which is exactly what I think that everybody across the city is doing. Like I mentioned, the Bexar County Medical Association reached out. The Chang Foundation has reached out. We have had areas in our city that aren't from the southwest part of town, folks from other areas that want to know how they can help. And I think it's because they see that we're ready to work for our people.
But you do have a political Barbie over there to remind people that that's kind of a fairly new thing.
Yeah, I'm a rookie at this. So a lot of the things that I do, and that was given to me by one of my friends who said, oh, I saw this and I just had to get it for you because it reminded me of you. And so I think that there's not enough women still, I think, in elected office. And I believe that RBG said that she was going to be happy when there are 9. And so recently, I think Councilwoman Gonzalez or maybe it was Councilwoman Adriana, I can't remember which one of them said, when there are 11, we'll have, and so that would be super cool. But I'm just very fortunate to be representing our area of town, but more importantly, committed to working for them.
And forgive me if the question sounds sexist, but now, again, there are more women on the council. We had 2 women elected to the Commissioner's Court, which has been a long time since that happened. What do you think that brings to the city? We haven't had for a while.
Well, I think that women bring empathy and communication to the table. And so I think that we don't hold back when we want to show concern and care. And it's okay to show that we have that concern. And so I think that we had great plans for girls empowerment, all 2020, and again it was going to be the 100th anniversary of the ratification of the 19th Amendment, and women got the right to vote, and we know that not all women, and so it took a little bit longer for women of color to be able to vote, but as women we were hoping to celebrate these small milestones, right? And then COVID hit and we realized, goodness, there's a lot of other priorities other than trying to champion these women causes. And I'm appreciative also of my male counterparts. They've been very good to us. They've been saying, okay, yes, they're right. So yes, we need to focus on this. We agree.
City Council is more than a full-time job, but you have a doctorate and you're also teaching. Mm-hmm. Where are you teaching? Let people know what you're doing.
I teach at Our Lady of the Lake University, and I have been teaching there. This is my 11th year. I was as an adjunct. I was doing adjuncting for them, and then when I got my PhD, I got on a trial basis as a visiting professor, and then I got offered the tenure track assistant professor in marketing position. And so I love it there because my students, they're like me. A lot of their parents don't speak English. They come from backgrounds like mine.
First in your family to go to college?
First in their family to go to college. And so they realize that it can be done. And so when they see someone just like them there, they realize we can do it. I have one of my students, I'm so proud of him. He's getting a second master's degree. I just learned that this weekend. And so that's like the best part of it all, just seeing that they're able to be successful.
You had such a very, I don't want to say very, maybe a different background than people would expect with City Council. How do you like it on council, and where do you see yourself down the road?
Well, I read a lot, and so I read everything, and so I could literally go back and say, well, the minutes for this date said this, and has it happened? And so I don't see myself as a rubber stamp, and so if I don't understand something, I'm going to ask a lot of questions. In fact, I think staff has learned and has asked, do you have any questions? And they try to prepare ahead of time, and so I appreciate that because they know that I'm going to have questions, and I listen to every side of the story. So I will meet with people who are advocating for and people who are advocating against issues, and I try to have an equal number of meetings with these different groups because I need to understand both sides, but more importantly, it's the residents that I represent, and at the end of the day, that's what drives my decisions. It's the residents and what their needs are.
And do you like it? Do you see yourself doing this down the road?
I love it. I love local government. I don't know that I would be inclined to seek anything at the state or federal level. I just like local government. I think that we can be very effective. And so hopefully if the residents give me an opportunity to continue to serve them, I will.
What else do you want to say to people right now about either COVID or what you're working on? Your chance to talk to a camera and people in San Antonio.
Well, I want to let you know that I'm working on this really cool initiative with one of my fellow Longhorns. All right, it's always a Longhorn thing. With, by the way, the Consul General of Mexico is also a Longhorn, so that's how we get along well. But Beto Altamirano, who is the CEO of formerly City Flag, it's Iris now. One of my interns at Our Lady of the Lake, I oversee the internship program for the marketing students. And so I get to see their weekly reflections. And so I get to see some cool stuff that she's working on from her experience by reading that. And so as I was reading about her work with them, with Iris, she's one of 4 interns at Iris, I got an idea about an app that I think needed to be created. And so a lot of my students, if they were to catch COVID right now, they would probably reach out and ask, what do I do? Where do I go? And so, but they're also really good with apps. And so having information at their fingertips. So I reached out to Beto and I asked, hey, can we do something? Because as I'm looking at the numbers, Randy, we also see that the folks that have the highest level of cases are between the ages of 20 and 44. And so they use apps. And so it would be nice for us to put together something that they could download and they could say, okay, I have these symptoms, or what is the closest location to go get tested, or what happens if one of my family members have COVID, or what if I'm experiencing something at my job, where can I go seek help? What about the social emotional support? And so I wanted it to be all in one app. And so Beto Altamirano and the team are working right now on doing the app. I pitched the idea to the city manager and he loved it. I pitched it to the mayor and he was all in as well. So I was happy that we were able to try to get something going as soon as possible. I also think that it could be repurposed once we have a vaccine for COVID, and people can just go in and look and see where they can get a vaccine.
So you're working on an app to help people who have COVID or think they have COVID as well as the vaccine.
Yeah, it's basically like a COVID 311, right? So, or 411, COVID information. And so, and so that way they can have access to every resource at their fingertips.
How soon do you think that'll be out?
I'm supposed to get an update this week, so I'm excited about it, and hopefully we could do it soon. They did the election app, the one where the short line wait or whatever it was.
Oh, right.
They did it pretty fast, so I'm assuming that we can get it out pretty fast as well.
And now this is going to be developed by the city or through your students?
It would be through Iris, and they committed to doing it pro bono to the city. So that's huge, and hopefully I think what's most exciting is that they might be able to give it also to other cities, or have other cities across the United States take it. Or sell it to them, yeah. I have been in contact with one of my counterparts in Prince George's County, and she lost 6 family members to COVID. And so when we look at the demographic that we represent, it's very similar, and her area might be slightly smaller, but we have the same underlying health conditions. We share the same types of experiences, and so I reached out to connect and want to offer condolences and to offer any help that we can from learning down here. And so she'll probably be one of the ones also that I recommend, hey, check this out. The mayor and the city manager were very kind in saying, hey, if she wants to talk to our staff to figure out how she can help her folks, because one of the things that she told me, I'll give you an example, in District 4, 1,400 people have taken advantage of the utility or rental assistance, which is great news because they need it. In her county, 4 of the people she represents have taken advantage of it. And so that is not good. And so she said, well, there's a lot of red tape. And so I said, wow, we can have a conversation. We got very innovative about how we can offer help. And so it's going directly to the landlords, for instance, etc. And so anyway, I'm happy that we're also, even though it's a time of need and we're taking care of our community, that we're taking a little bit of time to help those across the way as well.
And Iris stands for what is it?
That's the name of the company. It was formerly called City Flag.
Oh, okay. So it's a company that some of the people work with that you're...
Yes, they're the ones that actually do our 311 app. So you can report potholes with a picture. And so they're the ones that are doing the COVID app, if you will. I don't know what it's going to be called, so I'm just calling it a COVID app for now.
Well, good luck with it. And thank you again for all your time. Appreciate it.
Yeah, absolutely.
Thanks.
Thank you.